Okay, so I decided to do a quick video about trying to be your own patient advocate, be prepared for a doctor appointment, or bring somebody with you that can be an advocate for you. Because in the beginning, when you are just at the end of the road, it just the pain is just unbearable. I mean, when I was first going to the doctors, I couldn't even talk. I mean, I was done. I didn't, I mean, I was out of it. And now, I mean, my pain is bearable, it's manageable. And I mean, because I've had 5 surgeries where I've had a lot of bad stuff removed from my head, and I just have, nerves behind my ears that need to be removed. That sounded weird. Anyway, so just a couple helpful hints. Just remember that you're there to see your doctor that you've probably waited months to get in to see, and when you get in there, you're excited. And I I think that it's a good idea to have everything written down. And I always in my iPhone have under the notes section, I put everything down that I want to discuss with my doctor. And if you're in the middle of a thought and the doctor tries to interrupt you, don't feel intimidated. Just say, please let me finish my thought. Because when you have chronic pain or you're on medication, if somebody does interrupt you, you're totally going to lose your train of thought. And it's important that you get out everything that you want to say to your doctor at that time. Also, being on so many different medications, like if you feel that, no, okay, I don't want to do this anymore. I've been on, this is the 6th medication you've put me on, and they help for like a little, but not really. I have horrible side effects. But the biggest thing is I still have the head pain, and make sure you always have a list of every medication that you've taken. If like you're on your 3rd neurologist and they're like, well, let's try you on, you want to remember all of that. Nope, I tried that. When? How long ago? Have that documented and have journaled like what the side effects were. But most importantly, I took it and I still had the head pain. Also, be specific. Like if the doctor's like, well, for our next appointment, why don't you keep a journal of when you have your head pain? I don't know how many times I had to tell my doctor, how about I keep a journal of when I don't have the head pain? And then when you see me next, you're basically going to see a blank piece of paper. So just try to be as strong as you can and be prepared. I'm doing this because I'm finding that, unfortunately, a lot of you that I've been talking to don't have as wonderful of doctors that I do at Georgetown University Hospital. And my doctors are so great, and they take so much time, and they listen, and they answer my questions, and they talk, and they're so busy. I mean, every doctor's busy, but every doctor also took an oath to help their patients. And this is not textbook, and it's very complicated. And also, if a doctor suggests, okay, we're going to do a nerve block, make note of how you really felt after the nerve block. Some people, they have nerve blocks and they feel great for 8 weeks, and then they just decide, I'm going to go in every 8 weeks and I'm going to have a nerve block. And oh, God love you, I'm so jealous, because that would be so easy. But when I've had several nerve blocks done with different medications. I don't know if you're aware of that, but nerve blocks, they do use different medications. And one of the nerve blocks I had that they went in through my eyebrow and in the back of the head, I was on all fours for like 3 days, and I did journal that. It was horrible. And I called my neurologist, and she said that, yeah, it actually can aggravate the nerve more. So now after that, it was like, okay, I'm not going to do that. I'm going to do a different, thing inside, with the needle. And I was good with lidocaine, that really numbed stuff up, and I was okay, even though it wore off. But, my neurosurgeon, Dr. Duchik wants to see, okay, you've been working with a neurologist, you've been on numerous medications that they weren't successful, but at least you tried them. You've had either Botox injections or nerve blocks, and, he'll, review or determine like what the outcome was of those blocks. And, he's not going to throw everybody on the operating table, but at least he can determine, how often your head pain is and where the pain is. And, also research, go to Dr. Duchik's website, which is linked to the foundation website, purplewithapurpose.org, and research some of the nerves, the peripheral nerves that he talks about. And, I've seen people with videos saying like, oh, I have pain right here, and here. And, that's where I've had like all those nerves removed. I'm completely numb. Like, I mean, I see myself like touching and I can kind of feel that, but these are all numb. Like, he's gone in my eyes and he's taken out the supraorbital, supratracheal, the zygomaticula, I can't pronounce that, occipital, and now it's the one back here, can't pronounce, that's just really aggravated. But again, that's my story, and I want to make that very clear. But just do your research and take your time. And if, I would hope doctors out there in the United States, maybe if they don't know about the peripheral nerve removal surgery, that you could, show your doctor the website and just, I'm not saying they're going to be like, well, yeah, I'll do that surgery, but we want to raise awareness. This is a solution, okay? This surgery is the permanent fix, okay? These nerves do not grow back. So if somebody's giving you that information, that means maybe a doctor is doing this surgery, but they may not be doing it the way that Dr. Duchik does it. Dr. Duchik, he does this, I don't know, I'm usually sleeping during the surgery, but he removes a large section of the nerve. He, I believe, burns off the nerve endings and the nerve is dead. And I may be speaking completely incorrectly, but all I know is that 100% the nerve does not grow back. It's impossible. But in the forehead, I know that he had to put some kind of connector rods in there because there's not enough muscle or fatty tissue, so that is so nothing would grow or reattach or get confused up there. So again, I'm not the doctor. I'm just being a patient advocate. I'm trying to help people out there that are suffering and are in such bad pain that they don't even know how to deal with doctors, just, be as, detailed with your pain, as specific as you can. Don't let a doctor blow you off. If a doctor does blow you off, just nicely say, okay, since you can't help me, do you know of anybody that you can refer me to? Doctors take oaths. If I understand if a doctor doesn't want to take a person like us because this isn't textbook and it's like, oh, I don't even know where to begin with you. I can't help you. I'm kind of rushing through this video because I don't want people to be bored, but just feel free to inbox me or contact me through the foundation. I'm here to help because I didn't have anybody to help because this was still all so brand new. And there is still so much that will probably be discovered every time a head is cut open. There's probably a new discovery. And I just want awareness to be raised and people to be pain-free and to get their lives back, and I feel like I'm 80% there, and I know the 20% is around the corner, and I'm just grateful to be at this stage. And I know I keep saying that in my videos, but you guys have no idea. I mean, I know I still look like death, but I don't even care about the way I look. I want to help people. I want to help people with my voice and with whatever, with my experience and with my story. So I hope this was a little bit helpful. And like I said, contact me with any questions. If you have any questions about the peripheral nerves that I've had removed, my surgical procedures, please contact me. I'm here for you. I hope everybody has a great weekend. Bye.